I'm also asking them to put in place productivity metrics that will allow them to decide how much staff they need on a particular study at a different phase of the study, which will help with budgeting and planning for the future. So forecasting is probably a big area that I want them to work on.
For the Liberia team, we're working on a very large RACI, and it's a little bit overwhelming when you first start looking at it to see who's responsible, who's accountable, so who just needs to be informed. But it's important for us to understand what the needs are for their own work that they're doing, to their own local Ministry of Health, to their own senior leadership at the hospitals, versus to our client, right, who's Leidos, our ultimate client, who is NIAID, and then to FHI Clinical. That's a lot of different stakeholders, and it's something that we are actually, do well and have done a lot over the years, is being part of these large organizational collaborations where everybody has a different role. So we know how to do it. We just needed to take the time to get it all documented and to sort of talk to each other about why it has to be a certain way and why somebody has to be responsible for something versus just being informed about something. So coming back, my action items were really about expanding their access to us in headquarters, to our experts, and expanding their access to what we've already created so that they have a starting point for what they're trying to create.